Hi, and welcome to video 2 of the EFFORT clinical trial training. This video will encompass the study procedures. We will look at the CRF, the enrollment procedures for day 0, the follow-up schedule for the trial, and what to do if a participant has a recurrence. The case record form is completed for each participant who is enrolled, and they must have informed consent signed. For reasons of confidentiality, the full names of the study participant are not written on the CRF. It is rather the subject number and the site, which appears on every page of the CRF. In the Cambodian CRF, you can see that the participant ID and the site are at the very top of the page. When completing the CRF, fill in using capital letters and check boxes with an X. I've put some red X's in the boxes there. Keep text brief, answer every question, and only enter results in the fields provided. Don't leave questions unanswered, and in the absence of a precise date, you can write DK for don't know and the year. Please use 24-hour time, and when making a mistake, simply cross out the entry, write the new entry, initial, and date the error. So the follow-up over the 6 months will be conducted as follows. For enrollment on day 0, they will have their pregnancy test, biosensor, microscopy, and inclusion-exclusion criteria to confirm eligibility for the trial. If they are eligible, fill out day 0 visit in the CRF. Record the hemoglobin and G6PD measurements and the microscopy results. There is also the signs and symptoms form, medical history form, concomitant drugs, etc. For lab sampling, we take 7.5 mils of venous blood. And then the treatment will commence. So schizontocidal treatment is Piramax, and a hypnozoite treatment according to the intervention arms. This will either be PQ7 or primaquine 14-day, primaquine 7-day, or tafenoquine single dose. For the first dose, it's given under supervision with food and a glass of water. And also on day 0, we have a costing questionnaire, or economic questionnaire, apologies. This economic questionnaire will be completed on day 0, day 3, and day 21. You can see it on the right-hand side of the screen here. Further to follow up, we go on to day 3 now. All participants will be reviewed on day 3. This is the clinical review where staff have to determine if the patient is tolerating the medication or whether treatment should be stopped early. Participants will be screened for evidence of hemoglobinuria or dark urine, gastrointestinal intolerance, or other adverse symptoms. At this visit, a capillary blood sample will be taken, And hemoglobin G6PD measurement will be recorded, as well as drug levels in the lab. If the participant has signs of significant or impending hemolysis, then primaquine will be ceased and he or she will be followed daily until a recovery is assured. There is a detailed SOP for acute hemolysis which outlines how the study team should manage suspected hematological events. And in the participants who are tolerating their medication, the study staff should remind the participant to complete the full course of their treatment. To reiterate, day 3 is important for safety monitoring. And at this visit, it is necessary to check any participant warning signs against the definition of hemolysis, which will stop or withhold treatment if necessary. We will now look at day 7 and day 14 for tefenoquine arm only. On these days, the participants receive a medical exam, a capillary sample is taken, and an adverse events assessment will be completed. Now we look at day 21, 28, 35, and 42, and month 2, 3, 4, 5, and 6, as these have similar follow-up procedures. Days 21, 28, 35, and 42, all participants return to the clinic and receive medical exam, capillary sample, microscopy. On day 21 and 42, they should have a hemoglobin and G6PD measurement. Drug levels will be analysed from the capillary sample. An adverse events assessment up until day 42, and on day 21, a costing questionnaire. From month 2 to 6, all that needs to be completed is the medical exam, capillary sample, microscopy, and the hemoglobin G6PD measurement. In month 3, we have a dissemination questionnaire, which we will go over now. The dissemination questionnaire will ask the participant what they would prefer or their preferences for after the study is completed and learning the results of the trial. This is a one-page simple form to complete. Finally, if a participant returns with recurrence, we have a medical exam, a venous sample, malaria microscopy, G6PD hemoglobin measurement, and they will need to begin treatment and receive treatment education, as we'll go back to a schedule for 21 days. Again, only day 7 and 14 for tefenoquine, and then after day 21, they will return back into the schedule that they were on to commence. If you are a little confused by the recurrence procedures, do not worry. We have a system and a database available where you will be able to enter the date of the recurrence, and a new schedule will be generated automatically with their dates and their follow-up return to schedule as well. And that concludes the follow-up video for now. Please take the time to watch the safety reporting video, and if you are in the lab, we have a lab procedures video, and if you are a data entryist, we have REDCap and Access data entry videos. Thanks again.